So why does weight loss improve PCOS? And this is probably a very common question, and a very common thing in the back of a lot of ladies' mind. Like, okay, I have PCOS and they're telling me to lose weight, but why is that? So basically, people with PCOS have an excess of what's called androgenic hormones. So androgenic hormones are more like your testosterone things like that, which basically cause ladies to have like abnormal facial hair or abnormal hair growth. And I'm sorry, that's my daughter. But abnormal hair growth, and also it affects the way that they ovulate. So they don't necessarily always ovulate. They have cysts in the ovaries, which is why it's called polycystic ovarian syndrome. These ladies are at higher risk of type 2 diabetes because of insulin resistance. And so that's why one of the treatments is metformin, in order to decrease that insulin resistance. And also metformin itself, by reducing insulin resistance, also helps ladies ovulate. So yeah, and so that's why they're at high risk for type 2 diabetes, because of the insulin resistance. The other thing too is, if a woman with PCOS has excess body weight or excess body fat deposition, like in the abdominal area, as I stated before in my previous videos, fatty tissue basically acts as a hormone, and so the existing estrogen that a woman has, it'll convert it into testosterone because of the aromatase enzyme that is found in the fatty tissue. And so it'll basically just kind of feed into this like cascade of like increased androgenic hormones, and then androgenic symptoms, and the non-ovulatory state, and all that, fun stuff. And so that is why these ladies are recommended to stay at a healthy weight, healthy BMI, in order to prevent that cascade from further worsening. And so by eliminating that excess fatty tissue, you basically have less factors contributing into this aggressive cascade.